may know. And thank you.
Hello, my name is Rick White, and I'm the director of the Georgia Military Veterans Hall of Fame. I want to encourage all Georgia veterans to consider being nominated to the Georgia Military Veterans Hall of Fame. And if you are a Georgia veteran, and the definition of a Georgia veteran is either you were born in the state of Georgia, or you've lived here 10 years, or you were raised to right hand and joined the military in this state, you are considered a Georgia veteran. For further information, go to www.gmvhof.org, or you can contact me at 678-427-0915. We'd love to have your nomination for the Georgia Military Veterans Hall of Fame. Thank you so much.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
And you're listening to David's Pick, and today we've got Jeff Heel on, and we've been talking about, with Jeff, Agent Orange, and Jeff is a term would be a victim of Agent Orange, and I'm sorry for the suffering that you've gone through, Jeff, and it was scary enough just to hear what you did. You were a pilot and flew the tankers, the refueling tanker, and that's enough to scare me to death. But I guess in many ways you probably. Were you aware that where your hooch was the area that had been sprayed?
Was I aware at the time that it was being sprayed?
Yeah.
No, absolutely not. Never told us a thing.
Oh, jeez.
So it was kept under wraps. Never said a word. I can't, I don't remember anything during my tour because they just decided they hid behind the fact that this was a defoliant as opposed to, to get rid of body, to kill people with it.
Yeah.
And so there's a lot of blame to go around. Believe me, there's a lot of finger pointing, and it's a bad time, and so on and so forth. And it's really a sad situation that this could happen.
Oh, and to add to that, I have another friend that, they were ordered, just like all of us, going through basic training or AIT or whatever. You don't know where they're marching you to, and all of a sudden you're in front of a medic that's giving out shots. And this friend was ordered to take a shot. He said, okay, what is it and what's it for? And we can't tell you. It's classified. And, for the government to be able to do that, I just find, highly repulsed that, and it's like with Agent Orange. If they hadn't done the testing like they should have, that knew to know the effects, again, when I was farming, and this was all during Vietnam, as a matter of fact, we were warned about, the drift, the staying away from it, staying, from the defoliant and so forth. And, I guess if I've ever been disappointed in our government is the fact that they can slap a classified on it and you don't know what they're doing to you or what they're doing with you. And I find that, and yet I understand a lot of the reasoning in that a lot of folks, myself probably included, couldn't take the truth if we knew it. And yet I think we deserve, if we're serving our country, the country should serve us as well.
Exactly. Well, there were a lot of, obviously, from what I've read, there was a lot of pushback on this also. Originally, President Kennedy didn't want to use it. He was, for some reason, overridden by the Army because they saw this as a great tactical tool to help defeat their enemy, and you can't blame them. And sometimes I think during this whole process, the chemical companies like Dow and Monsanto and so on and so forth did not want to sell this to the DOD because they knew what the ramifications were. They knew about the dioxins, and they were overpowered by the federal government and made to sell this stuff to them so they could use it in Vietnam. So, there's a lot of stuff going on here, a lot of cross currents. And how do you place the blame? I don't know. It doesn't make any difference now. You just have to deal with it.
You hit it right on the head. You just have to deal with it. And your family has to deal with it. And this is something that we're really pushing right now. I think we helped. We tried anyway. That when the Personnel Record Center was shut down for a year, this was costing lives. When veterans needed to get copies of their DD-214s or whatever the situation might be, and they couldn't because the Personnel Record Center was closed. And
the excuse they used, and whether it was true or not, was that there was a huge fire in St. Louis at the Record Center.
Well, that was several years ago. This was all due to COVID in Washington.
Oh, I see. Okay.
And they closed it down for a year, and we finally got I had 2 colonels, 1 general, and 2 U.S. representatives helping us to get them to open it back up with at least a skeleton crew. And, these people were getting paid for doing nothing for over a year. And
sure.
that's deplorable. And when guys are dying because they needed to get their records, it was crazy. So we worked on that, and thankfully it's back to operational now.
Well, a story. I had some Navy submariners experience this problem because they were on these secret submarine missions off the coast of South or North Vietnam, and they couldn't get any benefits from Agent Orange compensation because the fact that they were there was never written down. So they couldn't prove that they were within a certain number of miles of the coast of South Vietnam. Therefore, they weren't eligible for any help. I mean, how bad is that?
It's worse than bad. If we can help them, let me know.
Yes, sir.
Blue Water, I was thankful that Trump signed Blue Water. And
yeah, they finally, evidently, I think, resolved it. But then they they're going to delay the benefit payments. Something about that.
That's ludicrous.
Yeah, whatever.
They
just don't have the money.
My feeling is I would like for a number of our representatives, or in fact, I have this thing lodged in my head that I don't think a person should run for office that hadn't served.
Okay.
We just had Rick McCormick on, Dr. Rick McCormick, who not only served, but he was an Marine pilot, and he's a great ER doctor, and he's running for 7th District for the House. So Rick's we just had him on, and he's a fantastic human being, and he will make one hell of a good representative because he's been there, done that, and can talk the talk. And,
God bless you.
Absolutely. I'm still amazed at what you did when you were flying a tanker and refueling. I think of you often, Jeff, just because of, and I will be praying for you now on the Agent Orange situation that, it's a shame for those that have raised their hand, and it's terrible when they're wounded or killed in action, and it's almost worse with the Agent Orange folks that are suffering. It's like there may be an end, but it's like you can't get rid of the mud on your boots, and it has to bring back some flashback memories, and did I do right or did I do wrong? And all I can say is that the population of the United States owes veterans a big thank you and a big hug and a kiss for, you had no idea, nobody had any idea that they would be exposed to something like this. And, all we can do is support our government to take care of our veterans now. And we certainly ask that they do. Rick Hill, it's been a pleasure talking with you again. As always, I ask, will you come back?
Sure.
All righty, you got a deal. We'll get with our favorite Colonel Rick White, retired, and see what he can do about getting you back on, and we'll be talking soon, I'm sure. And God bless you and all the others that were exposed to Agent Orange or exposed to war, period. That's bad enough as it is. And again, we thank you for your service, and thank you for being with us today.
Well, thank you, sir. Take care.
You too, sir.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Hi, this is Rocky Blair, former four-time Super Bowl champion with the Pittsburgh Steelers and Vietnam veteran. As a board member, I'd like to talk to you about Warriors to Citizen, a nonprofit organization that helps American heroes, soldiers, police, fire, EMT, and their families recover from the psychological harm caused by career-induced stress. Over the last 20 years, broken relationships have been a major causal factor for the highest documented divorce rate and resulting suicides in this population. This program, From Warriors to Citizen, is delivered free to families by professionals, all whom served in uniform and understand the needs to be addressed. I ask for your support, so please go to our website, warriorstocitizen.org, and find out how you can help, either by making a donation or sharing this information with an American hero that you may know. And thank you.
In 2009, the membership organization Docs for Patient Care was founded. People all around the country wanted to participate in the efforts of this group, and they wanted to join, but they were unable to do so unless they were physicians. It's for this reason that the Docs for Patient Care Foundation was created. Now, everyone can join the fight and become a member of an organization created by doctors for patients, dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. While you're at your computer, please go to www.docs4patientcarefoundation.org. That's www.docs4patientcarefoundation.org and make a tax-deductible donation and join the fight along with us. Thank you.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Hello, my name is Colonel Retired Rick White, a United States Army veteran, and I'm the director of the Georgia Military Veterans Hall of Fame. I would like to encourage all Georgia veterans to consider being nominated to the Georgia Military Veterans Hall of Fame. If you are a Georgia...
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Welcome back into the Doctor's Lounge. I'm your host, Dr. Hal Schurz. Each week, myself, alternating weeks with my co-host, Dr. Scott Barber, come to you and bring you the information that doctors are speaking about in doctors' lounges all across the country. The show is brought to you by the Docs for Patient Care Foundation, which is the only physician-led healthcare think tank in the country. Go to our website, www.d4pcfoundation.org. That's d4pcfoundation.org, and contribute generously so that we can do this show and continue to do the work that we do all around the country, trying to influence the behaviors of people who are responsible for making laws that affect each and every one of you. The Docs for Patient Care Foundation fights for the physician-patient relationship and for health care freedom all across the country. So please support the work that we are doing. Today I have a very interesting show that I am excited to be able to be part of. We've got a special guest which I'm going to introduce. We're going to talk today about mental health problems caused by COVID in children, or said another way, COVID-related mental health problems affecting children. And to help with this discussion today, my guest is Dr. Roy Benarock, a friend of mine. He is a Miami native, a Tulane graduate of Emory Medical School, and a trainee in residency at Emory. He joined a large pediatric practice, Pediatric Physicians, PC, in 1998, which is a Roswell, Georgia pediatric practice that's in the Atlanta area for those of you around the country. And he is also an author. He has written several books on parenting, including Solving Health and Behavioral Problems from Birth through Preschool, and also a guide to getting the best health care for your child. He's a pediatric expert for WebMD and has created online courses such as Medical School for Everyone and The Skeptic's Guide to Health, Medicine, and the Media, something that is very apropos in today's climate, skepticism about the media. He writes a blog called The Pediatric Insider, which focuses on parenting and healthcare topics in children. And my involvement with Roy, beside him being a referring doctor to me for a long time, is working hand in hand with him in an effort that we put together quite a few years ago here in Atlanta called the Children's Care Network, which is the largest of its kind, cooperative, and a clinically integrated healthcare network for children that has well over 1,000 doctors that are involved in it. And Roy serves as the chair of this group. I'm the vice chair, so we work together on this initiative and have done so for quite some time. So without any further ado, let me introduce Roy Benarock and invite him into the Doctor's Lounge. Good morning, Roy.
Good morning, Hal. Thank you very much for, wow, when I hear you go through all of that, it sounds like I've been so busy, doesn't it?
It sure does. You're an impressive guy.
But I think of myself as first and foremost a general pediatrician. Been doing it actually close to 25 years now, if you can believe that. And that's really my main job and my main love.
But you
plus
are
all that other stuff.
But you're very good at taking care of children. You recognize the problems in children, and you are an excellent educator and help parents to understand how to best take care of their children, which in this climate that we are now in is more important than ever.
Well, thank you. I completely agree with you. You know, kids depend mostly on their parents. Of course, other things, communities and schools and nutrition, so many things are important. But really, parents have most of the responsibility, most of the load. They've got the biggest lift, and they're what helps most important in helping keep kids healthy and happy and safe.
And that's a great segue into what we need to talk about today, which is how children are being affected in this COVID environment. It's an issue that people like you and I have recognized for quite some time, and there are a number of factors that are occurring. Some are unavoidable, and others are man-made, but nonetheless the effect on children is profound, and people like you and I have recognized this for some time, and it's only recently that it appears that the general public, the media, the woke crowd, if you will, are coming up to speed on this issue. There's been a couple of recent articles that we'll talk about a little bit later on in the show that have appeared in mainstream media, such as Time Magazine or U.S. News and World Reports, that are focusing on children's mental health issues, the mental health crisis in children. So, Roy, tell our listeners what effects COVID is having on mental illness in children.
Well, I think, the simplest part of this, which is what we were maybe too focused on for too long, are the physical effects. I mean, COVID, we know in general, the disease COVID is less likely to affect children than adults, less likely to have complications. So that's been known for a while, and that's been, unfortunately, what's kind of led the headlines, right, that kids don't have to worry about COVID and it's not a big deal for kids. And we sort of, the needs of kids were, I think, fair to say, a little bit of an afterthought. But what we've come to realize are more, I suppose, the indirect effects. We're not talking about the viral effects on the brain, which actually are serious, though rare. We're talking more about the way that the changing environment for children, the changing home environment and changing school environment, changing environment in the playgrounds has affected their overall mental health. And it really is profound in many ways, unfortunately.
So you mentioned about the virus itself, which is something that affects everybody, but children, they recover. They rarely require hospitalization, and even more rarely succumb to this disease as opposed to elderly patients. But the I guess silent issue is what it is doing to their mental health, and not being in school is a large part of this. Having to do home school and not necessarily having the resources to be able to succeed is another. Having parents who might have been laid off from work is yet another. The list goes on and on. Mm-hmm. So what are some of the things that you see in your patients that that you're hearing about that are direct or indirect effects of this pandemic on children?
We're seeing this in a lot of different ways. There are certainly many families who are contacting us whose kids are showing just overt signs of mental illness, symptoms, and we can go into that a little bit more, what sort of things you see when a child has things like depression or an anxiety disorder. And those are diagnoses that, unfortunately, we're having to make more commonly now. But there's also a very large group of kids who are just far more stressed than would be typical, that are disconnected from their friends, are moody, are doing poorly in school. They're lying. They're doing all sorts of things that cause concern, appropriately cause concern for their parents. And some of them don't necessarily have a mental health diagnosis, but they're certainly struggling. And sometimes parents are bringing them to our attention, specifically, look, my kiddo is doing this, he's not acting like himself. Or sometimes it's kind of indirect. In pediatrics, mental health issues, things like anxiety and loneliness, sometimes manifest by headaches or belly aches or symptoms like dizziness. So sometimes it's more of a physical symptom that drives the visit or the phone call, or the parents are contacting us via the portal, and they'll say, my child is having just for instance, let's say headaches 6 or 7 times a week. And as you dig into this, and there's more of an evaluation, of course, but sometimes it's turning out that it's the struggles they're having in school and with friends, or sometimes, related to their parent situation. Kids know when their parents are feeling stressed, that maybe parents themselves or grandparents have been ill, or out of work, or having financial troubles. All of that kind of trickles down. We sometimes try to fool ourselves thinking that we can protect our kids from family struggles. You know, we don't tell them that for instance, mom lost her job or something like that. But, you know, the kids, they know it. They figure out what's going on. They might not get all the details, but they can tell that their parents are in trouble or their family life is different, and they feel that stress, they absorb that stress, and it comes out in different ways.
You know, this is interesting because there was a panel that was convened, which were it was held by a number of children's mental health experts, talking about stress, and in U.S. News and World Reports there was an interesting article that said children's mental health crisis could be the next wave in the pandemic, and what they were alluding to is what's been termed adverse childhood experiences, or ACEs. And what happens is that children who are stressed release more stress hormones, and that may set the stage for various health conditions that could exist in these individuals for the rest of their lives, and not just mental health issues, but physical issues like cardiovascular issues or other issues that the stress hormones trigger. And so I think that this is something that's really underappreciated by many doctors who are not tuned into the mental health issues in children.
This is another very, very big issue. Research into the long-term effect of these adverse childhood experiences. It actually began, I think it's interesting, from the adult literature, actually, from studies that were looking at adults who were struggling with obesity specifically. That was how it actually started, which is a huge problem, right? A big problem for adults, and a big drain on the public health system as well. So many morbidities are related to obesity. And researchers were looking, trying to predict what people end up struggling with obesity, and is there a way to prevent it? And this was researched decades ago, actually, that going backwards, they found a very high proportion that these adults had adverse childhood experiences years ago, decades previously, and it seemed to predict continued struggles with obesity. Actually, research since then has linked the same adverse childhood experiences, not just to obesity, though, but to mental health disorders, depression, anxiety, but also to physical disorders, as you said, things like the increased risk of heart attacks and hypertension, diabetes. Almost any chronic illness you look at that affects adults can be traced, at least to some degree, as having a contribution to these adverse childhood experiences. Now, COVID itself, of course, is new, and there isn't any long-term data now looking at kids who lived through the era of COVID, but the same sorts of experiences that have been linked to long-term poor health in adults are the same kinds of things that are going on now in the era of COVID, and it's going to take a long time to sort it out, but I fear that there is going to be something here, that this year or year and a half or however long it turns out to be of disruption and closing schools and the many other things that have changed kids' lives will have some very, very long-term effects on their health.
So that's very interesting point, Roy, because closing schools, something that the experts now agree should not have been done, but yet is still going on in many parts of the country, going into the second year. This is, I think, a misguided policy, most would believe, and the repercussions, what these so-called do-gooders are going to cause in terms of the effects on these children and society as a whole. We talk about the effects on each individual, but the cumulative effects on our society, on our healthcare system, are almost immeasurable, wouldn't you say?
Well, I don't want to paint this as an overly black and white issue. I think there's still research to be done, And I'm going to disagree with you a little bit on a blanket statement that closing the schools was definitely a mistake.
Okay.
Especially as the pandemic was unfolding and it wasn't really clear who the vectors were, who was spreading it. I think that, specific school closures now in retrospect, I think it could have been done differently and should have been done differently. But, we have to make decisions based on the data that we have.
Right.
And I think it was certainly reasonable to do some school closures. Mm-hmm. And I could actually see that in the future, and there will be a future, and we probably need to talk about that, the next pandemic that will occur, specific school closures may have to be part of the solution. We just may, because when kids congregate inside buildings, they really are apt to spread viral infections. Now, it turns out that COVID is a little different from flu, though. It's not spread among children as efficiently as flu, as we know that now. And I think if we're going to pursue school closures as part of a strategy, it should be done much more specifically, individual neighborhoods with very specific sort of guidelines, at this rate of transmission, et cetera. I don't want to get caught up in the weeds, but I would say that, school closures aren't necessarily, let's say, always a bad thing. Mm-hmm. Now, in retrospect, I think they were done too broadly, and I think it is true that at this point they're being done for too long a time in too many neighborhoods. I guess maybe one glimmer of good news, one good lesson. I'm kind of overall an optimist. I will say we did learn that it is possible, at least in the short run, to close schools and introduce distance learning. If, for instance, there's a classroom that has an outbreak, that classroom should be closed. Those kids should be sent home for perhaps a few weeks. And we know that we can have the flexibility to do that. What I think has led to mischief and unfortunately, some long-term problems are going to be these big, broad, send the kids home, keep them home for a year, not provide the kind of support they use, not provide the technology they need to be successful, and treating all of the families the same. You might have some families in a school district whose parents are in ill health or who are especially at high risk of COVID, and having the option for some families for their kids to remain at home, I think was appropriate. But again, the overly broad approach, that I think we could have done a better job. I would certainly agree with that.
My guest today is Dr. Roy Benarock, Atlanta area pediatrician, and I would say an expert on behavioral issues in children. We're talking about the effects of COVID on the mental health of our nation's children. Roy, how do parents know that they should be concerned about a mental health problem in their children? This predates COVID. I mean, mental health issues in children has been an issue that has received very, very little attention. But I think that now it's been magnified because of COVID, and I think that awareness is now beginning to be amplified about some of these effects on children. But if you're a parent, what are some of the you mentioned this earlier, but some of the warning signs: anxiety, sadness. What are some things that, as a parent, might prompt me to call you and say I'm worried about my child because?
To me, the quickest, simplest answer, the simplest one-word answer that I share with parents is the word changes. Mm-hmm. That concept, that observation, my child has changed. So kids have their own temperament, and some are always a little bit more anxious than others. Some are more outgoing. Some toddlers have more tantrums than others, and parents get to know their kids, right?
Right.
But the word that perks up my ear is something like my child has changed. Mm-hmm. So for instance, a big change in mood that wouldn't be usual for your own child. So they become much more irritable. They become much more hopeless. They become perhaps much more angry. They're frequently fighting with their friends or with their family in a way that's very different from the way it used to be. Perhaps it could be changes in relationships. So they're stepping back from their friends. They're no longer keeping in touch with their friends. They have little interest in the sort of hobbies or social groups that they used to have. A child who, let's say, used to be a big reader, just stopped. They're not interested anymore. Or they stopped interested. They no longer draw. They no longer do art. Something like that. Big change. Sometimes they're more physical changes too, or changes in routine, like a hard time falling asleep or staying asleep, or sleeping all the time. Actually, the opposite, sleeping way too much. He never used to be like this, but now he's always in his room. He's always asleep. I would also think about changes in eating patterns. He only will pick at his food. He doesn't eat anymore. Or the opposite, actually. Gaining a tremendous amount of weight, eating all the time can be a manifestation of internal stress. So those are kind of the things that I point out that I want parents to look for, changes in the normal baseline of how their child behaves.
And you mentioned a number of physical things. There, just for the parents who are listening to this podcast, it can be other physical things as well, correct? Like headaches or stomach aches, rashes, right. Things that are manifestations of stress. But some of the other things that parents that we've seen in increasing numbers in children, which are now increasing in this environment, are things that are gigantic red flags, like alcohol use or drug use, correct?
Absolutely, right. Now, those tend to be, in a sense, more obvious. Parents recognize that that's a big problem. But, of course, that's something that brings kids to my office. Some teenagers have always dabbled, for instance, marijuana is sometimes in the schools, or vaping and things like that. And but some of the kids are truly becoming dependent. They're using substances as an escape or as a way to essentially treat their own stress, their own anxiety. They seek these things out because, at least in the short run, it helps them feel better. Unfortunately, these substances are easy to get your hands on. In some communities, they're legal, at least for adults. And so that sends a little bit of a mixed message. There's certainly not a healthy way for our teenagers to deal with rough times.
And many times these substances exist in the house already because parents have them in their medicine cabinets.
Sure, yeah. And the medicine cabinet is an important point that kids, teenagers, will sometimes help themselves. And parents really need to keep an eye on the prescriptions that they have. I believe, in fact, the most common source of opiates that teenagers sometimes will find, we're talking here about sort of painkillers that dull the mind, is from their parents' own house, from their parents' medicine cabinet, or from the homes of friends and relatives. That's where many people are getting hooked or getting started.
So beside a change that the parents might sense, are there any warning signs that you hear that when you're talking to your patients or to the parents of your patients, things that are other red flags to you, bells and whistles going off that say to you, we need to get some help for your child?
Yeah. Well, when I talk to the kids, and of course, I'll ask the parents to step outside if the child is comfortable with that. I ask pretty direct questions about what's been on their mind, what have they been thinking about. And some of these kids are thinking about suicide or thinking about harming themselves or harming other people.
Yes.
Some of these kids actually have come up with a plan. And when I talk about that with my patients, I remain very, very bland. I don't want to increase the anxiety of the room. But thoughts about suicide, or especially a specific plan, is a huge red flag that immediate intervention is needed. Unfortunately, suicide is something that is a common cause of death among teenagers, one of the top causes of death. Many homes have guns or have pills or other sorts of things that in just a few moments poor impulse control, which I think all of our teenagers have to some degree.
Not just teenagers.
Very, very tragic outcome. Not just teenagers. That's true. So certainly among rules up there at the top, first things families need to do if they have a teen or even a preteen, that there's concerns about depression, there's concerns about mood and irritability, to get those guns out of the house, or if you just can't stand to do that, make sure they're locked up separately from the ammunition, and realize that your teenagers know the security code for your gun safe. They know it. They're very, very smart. So please change that code. Even if you think, they don't even know there's guns in the house. Well, guess what? They do know, and they know how to get their hands on them. So let's make sure, at the very least, first steps, let's protect them from the sorts of things that can cause immediate harm.
Wow. I want to get in the next segment. I want to get a little bit deeper into this suicide issue, which is, I think, epidemic right now. It's become, a major problem that has been amplified because of COVID. And we're gonna do, I think, a lightning round. I'm gonna mention some issues, and I'm going to ask you to respond to them. And finally, I'm going to ask you to maybe share some specific instances of patients that, without naming names, about what kind of issues you've recognized and how you've been able to intercede. So I'm going to ask everybody to stay with us in this very important episode of the Doctor's Lounge.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients, dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down www.docsforpatientcarefoundation.org. That's www.docsforpatientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.
Hi, I'm Dr. Mike Karuchak. Join me and my co-host, Dr. Hal Schertz, every Thursday morning at 8 a.m. and listen to the Doctor's Lounge, where you get a private insight into the conversations that doctors have amongst themselves. Join us Thursday, 8 a.m. every week.
In 2009, the membership organization Docs for Patient Care was founded. People all around the country wanted to participate in the efforts of this group, and they wanted to join, but they were unable to do so unless they were physicians. It's for this reason that the Docs for Patient Care Foundation was created. Now, everyone can join the fight and become a member of an organization created by doctors for patients, dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. While you're at your computer, please go to www.docs4patientcarefoundation.org. That's www.docs4patientcarefoundation.org and make a tax-deductible donation and join the fight along with us. Thank you.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Welcome back into the Doctor's Lounge. I'm your host, Dr. Hal Schertz. My guest today is Dr. Roy Benarock, Atlanta area pediatrician, mental health expert in children, and someone who works tirelessly at trying to educate parents about the well-being of children in his practice and those who aren't, by virtue of the work he does, writing his blogs and on the internet and heading the Children's Care Network, which is the largest of the integrated healthcare systems in pediatrics in the country. Roy, we have had a very interesting conversation thus far about the effects of COVID on mental health in children, how parents could recognize these problems if their children are experiencing issues, what you look for as a pediatrician to try to uncover issues that may be causing problems for these children. But I think that the the worst of all problems that can occur in a family is when a child decides to take their life, suicide. And this has really become a national epidemic, hasn't it?
Yeah. It's really quite sad, but unfortunately rates of both successful suicide, that's a terrible word to use, but let's say completed suicide is probably a better term, or thoughts of suicide, attempted suicide have all increased quite dramatically in terms of presentation to emergency departments and to mental health professionals and to generalists like myself. I'm a general pediatrician, but there's a big intersection there between the work that I do to help kids with mental health disorders and psychiatrists and psychologists in the field.
There are not enough pediatric mental health experts. That's why all pediatricians need to become mental health experts. Wouldn't you agree?
That is 100% true. Mental health issues were something that was not really a focus of my training, which was 25 years ago, but it has been a huge part of my practice and therefore has become a huge part of my ongoing training. So that's something that I spend a lot of weekend courses and reading and all this sort of thing so I can stay up on this. Both recognition of mental health disorders and treatment, because we just don't have the resources to refer kids to. There aren't enough psychologists, there aren't enough psychiatrists. The kids are hurting, the families need help. So often pediatricians and family medicine physicians are stepping in. And I think, we're doing a good job helping, but we do need more support, and we certainly can't do it on our own.
I this show that I do every week is I would like to think is it's a resource. It's a privilege to be able to do this, and I think today's show is very important because there are going to be parents who are listening to this show who may have a child that they're worried about, and I think that they need to make sure that their child is connected with a doctor who takes these issues seriously. And I know that in the integrated network that you are the chair of, I'm the vice chair of. It's a primary concern. It's something that many resources are being directed towards to try to improve how we respond to children with mental health issues. Can you elaborate on that a bit?
Yes, this has been recognized for years at the level of our offices, from parents. I mean, we know this has been a crisis from well before COVID, honestly. So really one main focus of our integrated care network is improving the mental health of our children in several levels, too. We're trying to get very, very robust data, right? The way to make best decisions is if you know what the problems are. And actually, I pulled some data. I can share it with you if you're curious, just yesterday, about what's going on in our network with mental health.
That would be great.
Yeah. You know what? Let's go through that. I want to talk more about the other efforts we have, but one of the things that we're able to do with the clinical network is have our clinicians, about 1,300 plus pediatricians and pediatric specialists in the network, and we all share our data. Now, this is all anonymous, of course. We definitely protect the identity of our patients, but we can look at surveys, we can look at large numbers, and I just pulled this with the help of the staff yesterday, actually, and to make it simple, I was comparing numbers just between 2019 and 2020 as sort of a handy shorthand. 2019, of course. Does anyone remember 2019?
No.
That was pre-COVID. Remember that? And then comparing the numbers to 2020, of course, COVID probably appeared around December 2019, and by the end of February 2020, is that about when shutdowns occurred? February, March, I want to say.
Yes, about March.
So I just looked at 2019 versus 2020, and just to share some round numbers here, looking at, let's see, let me pull this one. Let me look at anxiety disorders. So those are things like generalized anxiety anxiety and phobias and social anxiety, the rate of those diagnoses comparing the 2 years was up, depending on the specific diagnosis, the increase was between 60 and 200%, actually, for some of the individual diagnoses, doubled across those 2 years. Depression was up, again, depending on the exact diagnosis, but just as a round number, up by about 100% as well. It about doubled. And even just visits to discuss the concerns, visits concerning concerns of anxiety increased on our whole network from 27,000 to 46,000. That's not quite double, but it's a huge jump. Concerns of depressive symptoms went from 20,000 visits to 30,000 visits. I'm just throwing out a couple of examples. It's a big page of numbers I have here, but this is solid, hard data that's showing that in a year where overall our visits decreased dramatically, we saw far fewer visits in 2020. That's an effect of kids staying home and parents being afraid to leave the house. Even in the face of far fewer visits, a very large jump in visits for mental health concerns. And this was actually starting before COVID. These trends had actually begun before COVID. So we've got the data to prove it, and there's some publications that have been made recently, not from my network, I'll admit, but from other centers. What we're trying to do, we provide the data, we're trying to support sort of the infrastructure so that pediatric specialists and pediatricians can provide mental health support using tools like telehealth. We're trying to support appropriate reimbursement from the payers for us to have the time to address these mental health disorders. And in the long run, I think that the best thing that we can do, and what we're working very hard at, is trying to improve access so kids have access to not only their primary care physicians, but mental health specialists like psychiatrists and therapists and social workers. There's all sorts of barriers in place, but through networks like ours, hopefully we can connect families to the resources they need.
Roy, has the lack of adequate reimbursement for these problems been a barrier for treatment for children who have these problems?
Wow, that's kind of kicking a hornet's nest, I would say. For years and years, let's just say for a variety of reasons, mental health has been kind of carved out from the usual medical system we have. You see separate providers, the reimbursement rates are separate and lower, and this has been going on for a long time. This has been a source of frustration that's just coming to a head because the need has increased so dramatically. The bottom line, though, is, if you want to have good access to mental health providers, you have to pay the mental health providers appropriately. Many don't even accept insurance plans because the reimbursement is minuscule and not worth the hassle of filing. And, that might not be a huge problem for wealthy families or families in the suburbs who have a large number of providers around them, but it especially hard for families who are economically disadvantaged. They've been just clobbered both by COVID, by the mental health disorders that accompany it, and sort of any way you look at it, the underrepresented, disadvantaged families, they I don't know how else to put it. They just take it in the shorts. They get hit much harder, and they're the kids who in some ways need it most. So we need to provide these services both for everybody, for wealthy families, for families that have, quote, good insurance, but also for families who have no insurance or have public insurance. It's a problem for everyone. In the long run, we're going to end up paying for this, so we might as well try to intervene when the kids are young.
We're paying for it already, and
exactly. Right. We're paying for it. We're paying for it, unfortunately, through increased emergency department visits. That is the most expensive and worst place to offer mental health. Now let me back up for a second. I don't want to say worst place. For the families who are listening, if you have a crisis, if your child has attempted suicide or is talking about suicide, please have no hesitation to go directly to the closest emergency department. Okay? The emergency departments can take care of you, and I'm glad they're open. But in retrospect, often there was a way to intervene before going to the emergency. Not always, but usually there were hints. Usually there were issues that were creeping up, that were snowballing, and it would have been better if access could have been there for a mental health provider before the emergency room was necessary. So I don't want to scare parents away from the emergency department. That's the best place to be when you really need it. But what we have to do is make it so that families don't need to rely on the emergency department, which is very, very expensive and, frankly, a terrible use of mental health resources.
You know, I hate to keep bringing this back to school closures, but so much of what we're talking about, so many of these problems can be directly tied to school closures, because much of this support for many of these families actually comes through the experiences that these children get in school, whether it is nutrition, the lunch that they may not be able to get at home because there's a food shortage crisis, or the counseling that many of these children get at school, which is no longer available to them. So I think that we need to learn from this that that if there's ever another pandemic or emergency, that we need to understand that maybe the most vulnerable people in our society are the children. They're not the most resilient, and they often get overlooked.
Yeah. I would also add to your list of important resources in school, just the peer networks, just being with their friends that they know and they trust. That's such an important part of a child's life, in addition to the counselors and the teachers and the administrators who provide support in the schools. You're right. In their own way, kids can be very resilient, but they shouldn't be an afterthought. I think we were so focused on businesses and restaurants
and the elderly right? The at-risk
and
population.
the elderly, and these are all important. I don't want to sort of take away from how important it was to protect, especially the elderly, who are at such high risk of complications of COVID. This was complicated. I hope that as things settle down, that we can sort of objectively look back and learn these lessons, which will have to include admitting that some things could have been done better. That's okay. That's how we learn. That's how we grow. And we've got to put kids and their needs right up there, not on the back burner, not as an afterthought, but kids and schools should be really quite important. And I think the communities are going to want to or should do what they need to do to keep the schools open. That should be what do we need to do in our community so that we don't have to close the schools. Of course, that means keeping the rates of transmission of COVID or whatever the infection you're fighting, keep those community transmissions low. If you can accomplish that, you can keep the schools open very safely. So how do we do that? Well, that's a big question, probably a little beyond what we're going to talk about in the podcast this morning, but that really should be a goal.
Roy, would you feel comfortable sharing a couple of specific examples with our listeners about problems that you've uncovered, diagnosed, and how you've intervened?
Yeah, I think that can be illustrative. I need to be a little bit careful, of course. I don't want to cross any lines in terms of privacy. These are very difficult issues for families, and I want teenagers and my patients to feel that they can share things with me. Let me tell you a story. This may come across a little hesitant because I'm going to deliberately change a lot of details here. So if I stumble over a word, it's because there's something I don't want to say specifically.
I appreciate
I would
that.
hate for anyone to be able to identify exactly the case I'm thinking about. But this was within, let me just say, within very recent memory, a simple, what I thought was going to be a simple visit was a teenager, a young woman who came in to my office, and actually the complaint, we get what's called a chief complaint, which is why are you here today, was actually allergies. That was what the nurse had put in there, and that's what it said when they made the appointment. And they were given appropriately a simple 15-minute allergies, common this time of year, right, in Atlanta where we are. But the girl, she was looking down at her feet, and she really kept mentioning this headache. Now, the family was honestly convinced that the headache was being caused by congestion and allergies, which isn't a bad idea. It may have been. But as we talked about it, she really wasn't having the ordinary symptoms of allergies, the itchy nose and sneezing and rubbing the nose and congestion and things like that. What she really had were headaches. And although she had resumed, actually, she had been in virtual school but was now back to face-to-face, she was staying home because these headaches were keeping her at home. And we talked for a little while, and as I often do with teenagers, I said, let's keep talking with it. How would you feel if your mom and dad stepped outside? They had actually both accompanied her. The mom and the dad. This was a family where both parents were very involved, were very caring, where they certainly wanted to do the best for their child. So they did step out, and then I talked to her, and then a few tears fell, and without sort of going into the details here, she had been super worried about a relative who had gotten sick with COVID, but she didn't want her parents to worry about her. Right, that was a big. She was trying to protect her parents because she knew they were already upset about this relative, and she was going to school, but she felt that she had missed so much school that she was having trouble keeping up, and she was having trouble focusing, and really the root of all of this was anxiety, and she had even crossed that bridge. I asked her, this sounds like it's been so rough for you. Are there times when you think of hurting yourself? And she had actually come up with a very, very specific plan. In fact, she told me the only reason she hadn't completed the plan was she was worried about how her parents would react. She didn't want her parents to worry. And that was the only thing that was, to say it bluntly, that was essentially keeping her alive. Her parents were trying to protect her. She was trying to protect her parents. Everybody was worried, and she was essentially non-functional when thinking about school and her friends. So, there wasn't really a very specific diagnosis here. This was a matter of then bringing the parents together with permission from the child, of course. Let's talk about this together. Can I bring your parents back in the room? I think we'll all feel better if we can get this out in the open. And I actually did not end up referring them for mental health. I didn't start in medicine. It wasn't about that. It was about opening communication. And then I actually saw her again just a few days later, and I talked to her on the phone a few times, and we've made arrangements for further telehealth. In the long run, I do think comprehensive therapy for anxiety might be helpful for her, but we were able to come through the crisis by just having a conversation, and I think it helped that I was someone they knew and trusted, and so I think that was powerful for the family. So a 15-minute appointment that had been driven by a concern of allergies turned into really quite a long encounter, but I was happy to do it. I mean, I think I was able to help and hopefully prevent a terrible crisis. By the way, let me just make a brief plug here because I mentioned it. For those of you who sometimes get frustrated at my office or at your doctor's office at the wait, we do not like to make you wait, believe me. But when it is your child in a crisis and they need 20 or 30 or 40 minutes of my extra time, I'm going to sit there in a chair and I'm not going to rush, and I'm going to get through the encounter and do everything I can to help them, even though it means the next few visits I'm going to be running late and people are going to wait. But I'm going to be there for you when you need my extra time too, I promise. So anyway, a little bit of a tangent there, but I did get some anger from the parents who came after me. And I know, Hal, as a specialist, you've had to deal with that too, right?
Yes. I always want to tell a parent, that's okay, we'll make up the time on your child.
Yeah. Well, and I'll you know what? Even if I'm already running behind, if you need my extra time, this is my job. This is what I'll be here. And people do sometimes have to wait, but I don't know of any way to know in advance exactly how much time I'm going to need. And certainly this family didn't realize that that's where this encounter was going to go. That they would be spending essentially an hour sitting and just chatting with Dr. Roy. That's all we did. We sat and talked, and I didn't prescribe medicine. I didn't order any tests. But hopefully I was able to help these people out. And these are the kinds of encounters that are coming up, I would even say several times a week in my office with kids and families near or at crisis levels in a way that sometimes sneaks up on people.
Wow, this has just opened up a whole thought process for me, this story, which I appreciate you sharing. it's heartbreaking, the hopelessness that this child had, and so many children obviously have, and the fact that they had a great pediatrician in you who recognized that this was a problem. How many pediatricians might not recognize this because they are trying to rush through a busy schedule, and they don't really think about what else might be going on or causing these problems, and that to me is really something that I shudder to think about. All these I don't know, these cases of hopelessness and you know and going to extremes that are being missed.
I fear there is quite a bit of that. Often manifest by physical symptoms, headaches and belly aches, or loneliness and isolation are so powerful, and it's affecting the kids and it's affecting the families. You know, that's for sure. And I think that physicians and nurses and all of us who interact with patients, really all along the chain, need to keep in mind that there's kids out there who really need our help. Even in your office, even as a urologist, I'm sure you've seen kids recently who have urologic symptoms, urinary frequency or pain that may actually have a psychologic or may be related to stress. And I think all of us are invested in the health of children and need to keep in mind that even if we don't feel that we're personally able to treat a mental health disorder, to at least recognize it and refer, let families know that there is help available, and help people get plugged in with the resources they need.
Do you think that these issues are now being recognized and getting enough publicity, recognition, airtime, or do we need to do a better job?
No, we need to do better, truthfully. I think it's getting more airtime. There was quite a bit of attention in the last few weeks. There was a recent study in JAMA. It was the JAMA Open Access Journal out of Chicago that illustrated how frequently mental health concerns and mental health symptoms were occurring. And that, I think, received a fair amount of press. I saw an article. I think you sent me the article from Time on that study.
Yes.
So there is attention, but I think that kids, I'm a pediatrician, I'll admit, maybe a little bit biased, but I think kids' needs really do need to be right up front. They really do need to come first. And there are ways that we can intervene earlier by providing the support they need, where the kids don't have to end up in a crisis. And part of that is appropriate support at school, to circle back to that topic. So I think more attention is needed. I think that lawmakers need to help make sure that that resources are available. As we're thinking about these, and we don't have to get into politics, but these big packages, these relief bills, a lot of money is being spent to combat COVID in different ways, economically, through enhanced testing, through supporting vaccine development. There's a lot of money there, but some of that money, I would love to see some of that money earmarked to support children's mental health and to better support schools to stay open, to give them the technology, the better ventilation, the things that schools need money if they're going to stay open safely. And I think that should be right up there at the top of the list.
Unfortunately, as a healthcare warrior for the past decade and a half, I've come to realize that children are at the bottom of the list because there's no constituency for children. They don't contribute money. There's nobody lobbying for them. And so that's why they unfortunately are an afterthought in so many ways. And again, not to get political, I'm trying my best not to. I often do on this show. But I don't think that the teachers' unions have really done these children any good at all, and are putting their own needs ahead of those of the children that they're supposedly responsible for and whom they've devoted their life to. And that's my political pitch.
So well, I'm not going to. Well, let's say this. I'm not going to agree or disagree with the statement in regards to the teachers union. But what I can, and I think we'll agree on this one, what I would say is that the vast majority of teachers, I think we can agree with this, the teachers I know, the parents I deal with who are teachers themselves, they really want to help the kids. They want to be in the classroom. They want to help your children. If they have the resources that they need, I think they can do a tremendous job. They're not in it for the money. They didn't choose to become teachers for some other reason. They chose to become teachers because they want to teach. And I think that they're an underappreciated resource. And when I say appreciated, I mean underfunded. And we're talking here the teachers in the classroom.
I agree with that.
I think that they're trying to do their best.
I completely agree with that.
Yeah.
It sounds like pediatricians can do a better job as well by educating themselves and staying on top of things. And unfortunately for people like you, your job becomes harder and longer because you can. The thing that we've learned from this pandemic is that the clock no longer exists because of the tele communication aspect of things, and so there, whereas your job might end at 5 o'clock, it no longer ends at 5 o'clock. It's really never ending, and the ability to reach out to your patients, there can be really no limits to what is the demands on your time.
Well, that is true. Although I don't necessarily mind that. I do call my parents in the evenings or on my way home from work and things like that. When people need me, I'd like to feel that I can make the time to be available. But the mental health of healthcare providers, I think, has to some degree suffered during this pandemic. In my office, we're not struggling with PPE. We have seen, of course, some kids with COVID in the office, but I'm not an ICU physician or an ER physician or an ICU nurse. But boy, let me just hats off to the especially ED and ICU people working in there, the nurses, the respiratory techs. They have worked their tails off.
I agree. I'm going to cut you off, Roy, because we're coming up to the end, and I want to thank you for being on the show. And I want you to have an opportunity to tell people how they can see you on your blog.
Thank you, Hal. Yes, my blog is at pediatricphysicians.com. We had talked a little bit about suicide. I actually have a very brief, it's only 45 minutes video course on the recognition and of suicide risk, focusing not only on kids, on teenagers, but on adults. That's available at the Great Courses or at the Great Courses Plus. That's a commercial product, but it's not very expensive, I promise. And it's very, very short, talking about the warning signs of suicide and what we all can do to recognize and help people who are at risk. So I hope that will be helpful for people.
Please go to that because Dr. Roy has a lot of excellent information for parents out there. And I want to thank everybody for being with us in the Doctor's Lounge today. My guest, Dr. Roy Benarock. And come back next week and join my partner, Dr. Scott Barber, on the Doctor's Lounge.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients, dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down docs4patientcarefoundation.org. That's DOCS, the number 4, patientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.
You're listening to America's Web Radio on the AmericasBroadcastNetwork.com. Thank you for listening.
Welcome, everybody, to another episode of the Doctor's Lounge. I'm Dr. Scott Barber, and you're listening to me on America's Web Radio. Today we have one of my favorite guests back today, Dr. Rich McCormick. Many of you may remember he's been on our show before, and I don't know, you're one of the most ridiculous people I've ever met. Naval officer, Marine officer, doctor, pilot, American Ninja Warrior, rugby player. I mean, I know I'm leaving a bunch of stuff out of there. He's also running for Congress, and he's going to be with us today. We're going to talk a little bit about the state of healthcare and what's going on with his campaign run. Rich, welcome to the show.
Thanks. Great to be on. Always a pleasure.
Awesome. So, this show, we always talk about the value of free market medicine, and I'm always trying to warn our listeners about the devastating effects of socialized medicine and how socialized medicine is actually not medicine at all. And I feel like the COVID epidemic has been a really good example of everything that is wrong in healthcare, and it gives us a way of demonstrating to people the problems with their healthcare. And also, I want to give people a little bit of a warning that our healthcare is more far gone than most people think. You got that card in your pocket, you're not sick, so you're not accessing the system, and you still are under this belief that you have free market private medicine. But in reality, Medicare and Medicaid, which are government entities, have completely taken over our hospital systems, and doctors really have very little power. And just by way of example, in the last couple of weeks, I've had a lot of personal issues. Number one, my roommate from college, he had prostate cancer last year. He had his prostate removed and has been doing well, but he's been getting his checkups, and his PSA level is going up. PSA is a way of measuring the function of your prostate, and presumably, if you have your prostate removed, your PSA ought to be 0. So the idea that there's some still there is a little bit alarming, that maybe he's had a recurrence of this cancer, and he's fighting this bureaucracy that will not even allow him to have the test to see if his cancer has returned. And so he's on the phone, and it's really just this game that the insurance companies play to just deny care. I have another very close family friend who was not feeling well, went to the emergency room recently, was found to have a large 7-centimeter mass in her liver. Apparently she's got what they believe to be secondary liver cancer. She doesn't have the proper referral from a primary care, so she can't even get a biopsy for a month. She could be dead in a month. I take call at a bunch of hospitals around the city, and I share some of my stories with the listeners from time to time. And we had a patient come in with a hip fracture. I was supposed to do it this weekend, and I called on the weekend, and it's like, hey, when is this case going to go? And they just refused to tell me when it would go. And I was like, well, can you at least give me an idea? Is it going to be in 5 hours? Is it going to be 10 hours? And they just told me no, couldn't care less. And it got to be late afternoon. My patient hasn't eaten all day. And I called and I said, can you just give me a time? Is it going to be 10, 11? No, we're not going to give you a time. And I finally was like, you know what? Just feed the patient, and I'll do the case tomorrow. And we find out kind of through the grapevine that this was some kind of personal issue with one of the doctors there, the anesthesiologist, who just didn't want to work on the weekend. And this is the kind of thing that you get with socialized medicine, because it's a government bureaucracy. There's no real what we call discipline of failure, right? In the free market, if you do something and you don't do it well, you go out of business. In government, you do something, you don't do it well, it doesn't matter. You just get more and more money to keep failing and failing massively. So
that's because people keep on turning back to the government to fix the problems that government created. It's the inmates running the asylum, so to speak. The more regulation, the more they take physicians out of a position of authority, and the more they make administrators command everything, the less you have the people who are dealing with the patient and the patient, who should have this great relationship. They actually destroy the relationship, destroy our ability to make decisions and compare and contrast each one of us in what we do. And instead, they make a standard that was arbitrarily created by not a scientist, not a doctor, but a bureaucrat, by DC people and by people who pay DC people in order to find solutions for medicine, which is ridiculous.
Yeah, in many cases, the hospital bureaucracies put us at odds with our patients and create horrible situations. I'm just imagining what it must be like for my friend's doctor. He's saying, hey, listen, I'm worried for my life, and I want to get this test, and the doctor's completely powerless to make it happen. My friend who's got the liver cancer, same situation. Her doctor wants to help, completely powerless to fix the situation. There's nobody to talk to. I'm here trying to get a hip done on the weekend. I'm ready to go all day long. It's just not happening, and I'm completely powerless to make this happen. And it's just so frustrating. It makes you want to pull your hair out. And when I was coming up, I've been in medicine probably 20 years now. It's 30 if you count all my training. And I remember when I was coming in, the doctors who were older and retiring at that time told me, man, I would never become a doctor today. This profession has just gone down the toilet. And I'm thinking the deterioration of medicine since I've been it has been so monumental. It's barely comprehensible. And one of the things we talk about with the bureaucracy is the sort of the punitive nature of the bureaucracy. So rather than solve problems, the bureaucracy works to grow the bureaucracy and protect the bureaucracy. And by way of example, when I first started in medicine, you have a call schedule. So we have a bunch of orthopedic surgeons. We take turns. We had relationships with our patients. And so if a patient came in with an injury and I saw that they had a relationship with another doctor, it was common courtesy for me to pick up the phone and call that other doctor and say, hey, listen, I have your patient, Mrs. Jones, here. Would you like to see her? And most of the time he'd be like, I'll be right there. Hey, thanks a lot. And they would do the same for me. Now we don't ever call the other doctors because there's so much you can't get into the OR. There's so much negative incentive that doctors don't want any part of it. And then you get into this sort of what we call the punishment. So, I go in and I see a patient. This happened to me a couple months back. And, being an orthopedic surgeon who's been practicing for a long time, who's fairly experienced, I come in, I see a patient, and the diagnosis was knee infection. Of course, COVID was at the top of the list of diagnosis, even though the patient had a negative COVID test, but still the number one diagnosis was COVID. We'll get onto that in a minute. But they're worried about a knee infection. So I look at it and I talk to the patient and he says, I fell out of bed and I smashed my knee. Well, okay, that's a great reason to have a painful, swollen knee. And he was on antibiotics and he said, I feel like 90% better today than I did yesterday. So I figured that was the end of it. Well, the infectious disease doctor didn't like my diagnosis. And this particular infectious disease doctor fancies himself an orthopedic surgeon. He didn't like the fact that I wasn't taking this patient to the operating room. And so he consulted another doctor, orthopedic surgeon, who, when speaking to him, he said, I just didn't want to have a fight with this guy, so I took the patient to the OR anyway, and it was not infected. And I'm thinking, this has just got to stop. We've got to figure out a way to get control of our healthcare and put it back in the hands of doctors and patients. And then based on all this, I get an email from the hospital. You're being brought up in, I forget what the way they phrase it, but, before our board. And I have to go defend myself for just a routine decision. And the patient did well. And, I'm busy. And I ended up having to spend like 2 hours doing this. And all the other doctors that I talked to, they all have the same story. And I kind of remember being an adult and, we work in a high-stress field and you're tired and I'm tired and there are times we're going to butt heads. But you know what? We used to be grown-ups and we could just say, hey, listen, Rich, I'm really sorry. I was tired. And you'd be like, yeah, me too, no worries. And we'd move on from it. Everything didn't have to go to the board,
Oh, my gosh. So the verge system, which was supposed to make things safer for people, or the training that we do in the Navy, for example, where we had to, we spent 4 lectures just on learning how to talk well to a transgender person, which we didn't even have in the Navy at the time. The bureaucratic over-regulation has turned us against each other. The verge system, which is basically, for anybody who doesn't know, me writing up something that was a dangerous situation in the ER, for example. Well, a nurse just wrote me up the other day because I ordered a pregnancy test on a woman who had abdominal pain and was vomiting. And I'm like, she comes to me, she complains, this 20, she won't let me draw labs. I said, well, she'll take a urine test, just get the lab, I just add a urine pregnancy. She's like, well, that's going to hold us up in the ER. I'm like, that's okay. I mean, that's what we're here for. And she's deathly afraid of needles. And I've talked her into getting those labs if those come back without any sort of explanation. So she literally writes me up because the administration has made it that way. So since we had a disagreement, she can complain about me to somebody, even though it doesn't make any difference. She wrote me up saying, how dare he order a pregnancy test, and because that's not what I wanted. Well, come on.
Yeah.
And my wife, who's an oncologist, by the way, who suffers from everything you've ever said, she's an oncologist. If she wants to treat she's one of the best oncologists around. Doctor of the year for all of the county in North Carolina where we were before this. And she literally went to Vanderbilt trained, creme de la creme, 4.0 and everything she's ever done, and yet she cannot get a pre-approval to order what she wants to save somebody's life because of what you just said. Because some bureaucrat says, no, the doctor shouldn't be in control. It should be a politician or an administrator that decides what test you order. Ridiculous.
Yeah, it really is out of control. There's this thing called a wound vac. I know you know what it is, but it's kind of this. You have a wound that's open. You put a sponge kind of in the wound. You put this cellophane kind of material over the top of it, cut a little hole, and you put a little suction device on it, and it creates negative pressure on the wound, which promotes wound healing. And we usually go to the operating room to put these wound vacs on, not every time, but a lot, just for the comfort of the patient, so we can kind of dig in there and get all the tissues clean without hurting the patient. And they usually have wound vacs that are designed to be in the hospital, and then other wound vacs that are designed to go home. And I'm the doctor, so I put the actual apparatus on, the sponge and the attachment, but I don't have anything to do with the machine. I mean, I write the order. I never even see it. I leave and somebody goes to the patient's room when I'm not even there and hooks the actual machine up. So I write to discharge the patient home, and the person who puts that machine on puts the inpatient machine and sends it home with the patient. So I get a call on Saturday from that person saying, "Oh my God, I made this mistake. I sent the patient home with the inpatient machine. We got to switch it out." And I'm like, "No big deal. I'll just, when they come in on Monday, I'll just switch it out," which I did. So a month later, I get reported for sending home the inpatient machine, and I'm sitting here. I had to spend, half an hour writing a defense and going before the board, and it's like, I literally have nothing to do with this. And and even if I did, so what? Somebody made a mistake and sent the wrong machine home. So what? We got it back. It's not a big deal. But this is kind of the way socialism works, right? The bureaucracy gets in there, and then everybody becomes defensive. It's taking care of the patient is really not even on the radar anymore, is it? It's about getting through your shift. It's about not getting in trouble. It's not creating waves.
So the one thing I thought was the most frustrating thing about military medicine when I ended my career in military just a few years ago was that the administrators were basically, you could make rank, not by being a great surgeon. You could be the greatest surgeon and never make rank because you're too busy to do all the other issues to become an administrator and carry around a board to make sure everybody else wasn't making mistakes. And I thought it was this horrible idea of a zero defects mentality that you could be the best in the business. You could be the best trigger puller, for example. But if you weren't good at paperwork, you're not going to make rank. So you end up with a bunch of paper pushers making rank and watching over everybody else. And so they end up basically sitting around and telling everybody else what they're doing wrong while everybody else is doing all the work. And it created this horrible inverse relationship to the people that should be promoted versus the people who are actually in charge, making sure that nobody made mistakes, because it's so easy to get a good night's sleep while you're working extra hours in the OR and in the ER, and yet I can go home, get family time, make sure I get a good night's sleep, and come back and make sure everybody else didn't make a mistake. And that's my job, and I get paid more to do that, by the way.
Yeah, my father was a career military officer, and one of the greatest things he taught me a lot of great things, but he taught me about bureaucracy. He was, being in the military, of course, there's lots of bureaucracy, and he used to teach me a couple things. Number one, the rule of no blanks, meaning whenever you have a form, it doesn't matter what you put down there, you just can't leave anything blank. And he also taught me about incentives. People do what they're incentivized to do, and they don't do what they're incentivized not to do. And so when you get all of this paperwork and stuff like that, it actually influences our behavior, because you think to yourself, there may be some tack out there, some decision, some procedure, some action I might take that might be in the best interest of the patient, but it's going to create a whole lot of paperwork for me. Should I even bother doing it? And we see a lot of that where people just, I'm not even going to play that game because I don't want to do all the paperwork that comes with it. It's really kind of gross.
Yeah, especially if you're in a socialized medicine, VA, perfect example, right? There's no motivation to actually have a bunch of OR cases, because why would I do that? I don't get paid more for it. And by the way, I might get sued for something. So why don't I do as few possible cases and then I'm not going to have any trouble. I can work. I can go home quicker. I'm not going to have to worry about my pay. I'm never going to get sued. Everybody, and if they don't like what I'm doing, they can send it to somebody else in the civilian world who's going to fix what I screwed up, because I'm not going to be proficient. They have a hospital in South Dakota that was protected by certain senators. A VA hospital would think a census of like 5 per week. I mean, something ridiculous. And that's not counting. I mean, that's everything.
Great allocation of resources.
And so you have the administration, you have the electricians, everything in one hospital that wasn't. And by the way, the doctors, you'd never want to operate on you because they weren't proficient. So anytime they had a surgical case that was worth anything, they sent it out. So it didn't even do the job it was meant for. But by God, they had a VA center that was top notch that the taxpayers paid for.
Yeah, we used to, when we'd work at the VA, we used to say you have the morning case and the afternoon cases, because they could only do 2 cases in a day because they were 2 different shifts. I mean, it really was quite extraordinary. And it also helped me understand and learn the difference between the work-driven employee and the clock-driven employee, and the tension between the two. For guys like us, we don't go to bed till the work's done. But a lot of the people we're working with, they're just trying to make it to the end of the shift. So while we're trying to do as much as possible, you got another group of people that are constantly trying to sabotage because they don't want anything to prevent them from walking out the door at 3 o'clock. And it's this perverse incentive that affects the way we behave. And you can see it so clearly now. We got call schedules at hospitals that doctors simply don't want to be a part of. When they are on call, it's just a big exercise in how do I not get sucked into doing anything, and even if I do get sucked into something, how do I not get into trouble? I meet with an infectious disease doctor who doesn't like my decision making and wants to write inflammatory things in the chart or say nasty things to the patient, and it's just really creating a horrible situation. And the worst part of it is doctors and patients are not allowed to make their own decisions about their own health care. My brother fell down the stairs a couple weeks ago, hurt his shoulder really badly, went to go see a Stedman and Hawkins sports medicine guy, so a well-trained guy, and my brother sent me the MRIs and everything. He needs surgery. So he got, and then the doctor that saw him also recommended surgery, and my brother said he felt very comfortable that guy and I were saying the same thing, so it made him feel really comfortable and good about it, and so it was like, let's get the surgery done. So he gets the surgery done on Tuesday this week, gets home, and gets a letter from the insurance company saying the surgery was denied. And he's like, I don't even understand that. I just had the surgery. And I'm like, well, don't worry. It doesn't affect you. It's going to screw your doctor over. He's not going to get paid for doing the surgery. And this is the game that the insurance companies play. They told him that the reason that they were denying the surgery was because he didn't fail 3 months of conservative care. This injury, I'm an orthopedic surgeon, this is what I do. This injury wasn't going to heal in 3 months or 6 months. It needed surgery. And, gosh, I remember a day when people who were experts in the field kind of helped patients make the decisions. And now you got these bureaucrats with so-called best practices, right? We're all this insidious onset of best practices, and people almost accept it now as if it's something to be accepted. I mean, in medicine, there is no best practices. There is no menu of treatment that works for everybody. When I was in medical school, we always learned every patient is an individual. You can't make any decisions until you lay your hands on that patient, till you talk to that patient, till you examine that patient. And now we got these best practices. Oh, you need 3 months of failed conservative care before we'll even consider surgery. What's going on here?
Yeah, rules are made for cowards that basically want to stand behind something. They don't have to make a real decision. And unfortunately, a lot of rules have been made because people have misbehaved. Let's face it. So when doctors overcharge or they do surgeries that are not required, and people say, "Oh my gosh, this doctor did something wrong," and instead of just prosecuting that one case and actually going through the trouble of making sure that person doesn't misbehave, I'm going to make a blanket rule for everybody to make their life miserable. And this is where government overreach continues to happen, is because of one bad incident. I'm going to be, as a politician, be able to say, look, I did something by making a rule that affects everybody in a negative way, but by God, I did something, so I addressed the issue.
So that's interesting that you bring that up, this idea that there are doctors out there that have behaved badly. Absolutely. I get asked all the time, how much would you charge for an ACL? And my response is always, as much as I could get. I mean, I take care of people, but it's a business. What keeps me in line? What keeps me from, charging $1 million? Well, it's called a free market.
Amen.
Somebody else out there is going to do it better and work harder and make sure that your scar is smaller, that your pain is less. That's what I do. I bend over backwards even when my patients are unreasonable. It doesn't matter. My place is called Barber Orthopedics. I'm the face of it. I'm going to make sure everybody's experience is absolutely the best it can possibly be. This idea that the doctor's not behaving properly, but the bureaucracy is looking out for me. Excuse me, did we not just have the FDA and the CDC and the World Health Organization prevent us from using hydroxychloroquine to treat COVID, a medicine that absolutely is safe and by many studies is effective? I mean, these people are not looking out for you. They have pressures on them, mostly political right now, and I happen to know for a fact when the phony studies came out on hydroxychloroquine in the New England Journal of Medicine and the Lancet, designed purposely to put a wet blanket on the use of hydroxychloroquine, because they knew that if people are out there taking this very cheap, generic, safe medicine, that people would not be getting sick and going to the hospital, and they wouldn't be able to get these huge COVID numbers and do all the things that stem from that, stuffing ballot boxes and all the rest that we know they did. They had to shut it down. And so they come up with these fake studies, and they basically create this situation where doctors are looking at these phony studies. It's affecting their behavior, and because there's no ability for dissenting opinion. I mean, in medicine, don't we normally have that? Like, you and I could look at the same thing, and you have one opinion, I have another. You're not wrong, I'm not wrong. That's just how medicine is. I mean, it's insane.
That's how we advance medicine, is actually by disagreements, not by making sure everybody's uniformly doing the same thing. That's the worst case scenario. The only advancements in medicine are based on our disagreements. When you say, look, I'm not going to use antibiotics for your viral infection, and look, here's the evidence behind it, and then we have an open debate about it, and then some doctors still won't get on board. That's why you have the choice of doctors, by the way. But that's why we wash our hands between surgeries when we used to not, because some dissenting doctor said, maybe we should wash our hands, and they made fun of them, and they censored them instead of allowing the ability to disagree.
Yeah, and it's this idea that somehow the FDA or the World Health Organization or the CDC or some government bureaucracy is going to be looking out for your best interests. It's just factually not true. Doctors, for the most part, I think are good people. I mean, I do believe the vast majority of doctors have something inside them. This is a hard, when I think of, I reminisce like, man, if I could be young again and everything, but then I immediately go, but then I'd have to go to medical school again, and that's out of the question. So I'll just stay an old broken down guy. I don't want to do that again. It was tough. The reason people do it is they have a calling, and there's a gratification in helping people. And are there bad apples? Of course there are. Are there incompetent people? Of course there are. There are in everything, but the free market weeds those things out better than any other method, any other entity. There's no bureaucracy. It gives people the most choices. I mean, you and I can sit and argue about the effectiveness of hydroxychloroquine. You got 65 years of data, and you can say, I think it doesn't work. I can say, I think it does work. And guess what? Patients get to listen to you. They get to listen to me. They get to make up their own minds, and they can do what they want to do based on how the information is presented to them. And, I mean, it's just so clear to me now. So much corruption in the last year. I mean, just obvious corruption, starting with, China, basically the World Health Organization parroting the Chinese narrative as it related to COVID. So, you had this pandemic breaking out of coronavirus. People who are familiar with China's Belt and Roads Initiative, where they basically go into these countries and they prop them up with Chinese money and basically get them on the hook so that they're beholden to China. Ethiopia is one of these countries, which, by the way, is where the head of the WHO came from, Tedros. So, of course, he's out there. China wants to continue travel early in the pandemic last year. So, Tedros, the World Health Organization, they put out a tweet saying there's no evidence of human-to-human transfer. Guys like you and me who went to medical school kind of are like, wait a second. Coronaviruses commonly have human-to-human transfer, and if it's the novel coronavirus, like you guys keep emphasizing, why would you make a statement like that when we don't supposedly know everything right now, when there's a very good chance it is transmitted human-to-human, which, of course, we now know it was? Well, at a time when China was banning travel within China, the World Health Organization, everybody else was letting travel go to every other corner of the world from China. So we basically spread this virus around the world. We know that they had a conference of world leaders, healthcare leaders, in Geneva, Switzerland, and bureaucrats from the WHO went to this meeting, and they discussed maybe we should ban travel from China. And basically, these bureaucrats from the WHO got these people to say, okay, no, we won't ban China travel from China to the rest of the world. And of course, the rest is history. You got the Royal College of London coming out saying it looks like the mortality rate for COVID is 3.4%. I mean, when I heard that, I was like, what are you guys doing? You're only counting the number of people in the hospital. Clearly, there are tons of people out in the community who have COVID and are not at the hospital, which is going to bring that number down. Why would you freak people out? In my opinion, it was designed to freak people out on purpose.
And most of these statistics are designed to freak people out. And let's face it, the worst decisions that have been made on this disease process have been made by these organizations. The absolute worst. If you look at the states that have done the worst in controlling and treating this disease process, it's those states that have overreached and taken the power away from the doctors. You look at the most draconian controls measures have resulted in the highest mortality rates. And still today, look, New York and New Jersey are hotbeds. Michigan are hotbeds, even though they have these huge, I'm going to make you wear a mask everywhere you go. You're not going to be able to socialize. You're not, all these huge rules, and yet they still have the highest and worst outcomes.
Yeah, you know, it's funny. Going to medical school and residency and sort of learning medicine, there are things we kind of know, things we kind of study. And I'm always talking to my friends about, you know, I didn't start thinking about masks in 2020. You know, I started learning about masks, 25, 30 years ago, studying them, the transmission of what we call influenza-like illnesses, influenza, coronavirus, paramyxovirus, rhinovirus, these aerosolized viral illnesses that we commonly refer to as the flu. The Journal of Epidemiology did a review of the literature from 1960 to 2009 and stated limited evidence supporting the efficacy or effectiveness of face masks to reduce the transmission of influenza-like illnesses. Before 2020, the consensus was that masks don't work. And then here's another thing. We used to think of masks as a particular kind of mask. You know what I mean? There was an N95. There was sort of the paper mask that we use in surgery. There was certainly the knowledge of cloth masks. The only peer-reviewed study that I'm aware of cloth masks, other than this bogus stuff that's come out lately, showed that you actually have a higher rate of transmission of influenza-like illnesses when you wear a cloth mask. How did this pseudoscience all of a sudden come into play? Any doctor who says, wait a second, I remember in 2019 when we thought another way, and then all of a sudden people are changing their minds, and I go to the hospital and I see people all masked up. What is happening?
So this is why I think the outcomes are bad, because it gives people a false sense of security. Oh, look, now that I have a mask, I can do anything I want to, because they just lock into one thing, and now I have this signaling. This mask has made me safe, and the government's okay with that. Hey, now we've done our part. We did our part. Now, if you get any disease process, because you didn't do what I told you to, but I made a rule, and if you got sick, it's because you didn't follow my rule well. And so it's this false narrative, and that's what I think, anyways. And anybody who's been, by the way, if you grew up in the smoking era, when my grandmother used to have parties at her house, smoke goes in every room. Yeah. Whether and smoke is thousands of times bigger than any virus, by the way. Yeah. And I don't care if you're wearing a mask or not, that smoke is going to go right through the mask. If smoke can go through the mask, what do you think a virus does? It's floating everywhere. Yep. And by the way, MIT just came out with a recent study that says 6 feet is totally arbitrary, which we knew already. It's 60 feet. Yeah. Well, okay, come on now. Yeah. So if it's 60 feet and masks don't work, so in other words, you're telling me that there's really no way to control this other than keeping sick people away from well people, which we knew all along. It's as basic to medicine as we've ever had. And yet we keep on coming up with these new narratives based on government, which is just guesswork, not scientifically based. By the way, the one study you referred to that said that there was a difference between it, I think showed a 1% difference. And everybody locked in, see, there's a difference. Well, 1%, anybody who knows how these studies are designed and what the outcomes were realized it wasn't statistically relevant.
Significant.
And then MIT just came out with another study. I think it was MIT. No, it was Ireland. Ireland came out with a study, basically the same thing. They showed a 3% difference, which is not statistically different. And that was based on whole demographics, based on whole nations and states and areas that were versus not using masks. So they really debunked that, even though we continue to say, oh, maybe 2 masks, maybe 3 masks, maybe, come on.
We're going to pick up a little bit more of this discussion about the research and how we're interpreting it when we come back to the Doctor's Lounge. You're listening to Dr. Rich McCormick and Dr. Scott Barber on America's Web Radio. See you guys in a minute.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down www.docsforpatientcarefoundation.org. That's www.docsforpatientcarefoundation.org. Go to our site and please make a generous tax-deductible donation and join the fight today. Thank you.
The Docs for Patient Care Foundation is your way to join the fight and become a member of an organization created by doctors for patients dedicated to fighting for your healthcare freedom and preserving the doctor-patient relationship. Get a pen and paper. Write down docs4patientcarefoundation.org. That's DOCS, the number 4, patientcarefoundation.org. Go to our site.
You're
and
listening
please
to
make a generous
America's Web Radio
tax-deductible.
on the AmericasBroadcastNetwork.com. Thank you for listening.
Good afternoon, everybody. Welcome to America's Web Radio and the Doctor's Lounge. I'm Dr. Scott Barber, and I'm here with Dr. Rich McCormick, and we are talking about COVID and how it has demonstrated the failures of American healthcare in 2021. We were talking about the various studies out there and masks and how before 2020, sort of the consensus in the medical community that masks were relatively ineffective at preventing the transmission of influenza-like illnesses. The masks had been looked at extensively in the previous 4 or 5 decades, and there really was no compelling evidence that wearing a mask was going to prevent the transmission of these types of flu-like illnesses. We call them influenza-like illnesses. And then suddenly in 2020, all of a sudden the mask became a thing, and there are a lot of reasons why I believe that happened. I know when it first happened, I was frustrated because being versed in the mask, having studied the mask for 30 years, having been thinking about masks for 30 years, I knew the masks were not effective, but my wife told me, don't say anything. The mask gives people a sense of control, and even though it doesn't work, that we shouldn't say anything so that people would feel comfortable. And I sort of went along with this, and I regret it. And I regret it because the proponents of masks have taken this thing to an absolute extreme. Both my daughters were in a school play a couple of weeks ago, and it broke my heart to see all the kids up there singing and dancing, all wearing masks. And I'm sorry if I hurt your feelings. I'm sorry if you disagree with me, but watching March Madness with these basketball coaches with the mask around their chin, and anytime they need to yell at a player, they pull the mask down and then put it back up over their face for a second. A lot of times they got the nose hanging out. You go to a restaurant, you wear your mask to the table, but then you take it off to eat. I'm sorry. If there's anybody